Dear students, welcome to our Good Samaritan School online classes of Class 12 Medical Diagnostics. Today we are going to learn about the topic PCV or packed cell volume. So what is the meaning of PCV? Actually, PCV means the hematocrit volume. It is defined as the volume of packed red cells, red blood cells in a given blood sample, and that can be expressed as the percentage of total blood volume. That means in total blood volume, what is the percentage of the RBC? That is called as the packed cell volume. It is the screening test of anemia usually, and along with the estimation of hemoglobin and RBC count, it enables the calculation of the absolute indices, and that is very useful to diagnose anemia. Three types of method can be used: Winthrop method, automated cell counted method, and microhematocrit method. But the Winthrop method is the best one. Okay. Actually, the Winthrop tube will be used here. The Winthrop tube is usually 11 centimeter long and the diameter is 2.5 mm, and it will be calibrated from 1 mm to 105 to 110 mm, and it will be holding 1 ml of blood. The sample that will be used as the blood collected by the venipuncture method, and it will be collected in the EDTA vial. Okay, that means the anticoagulant EDTA will be used in the vial. Now, how the method can be done? Actually, the Winthrop tubes will be filled by the Pasteur pipette. Okay, and up to the 100 mm mark, starting from the bottom, the blood will be pipetted properly, and then just to avoid the air bubble, it will be expressed. Now you have to centrifuge the tube at 3000 rpm for 30 minutes. So when it will be done, after the centrifugation, three definite layers you will get. The lowermost layer will be the packed red cell, then the middle layer will be the WBC and platelet layer, and the uppermost layer will be the plasma layer, because plasma is the most thinnest part of the blood. So I will show you the process by video also. What is the reference range? For male it can be 40 to 50%, or for female it can be 36 to 46%. Now let's see the video.
Volume red cells in a volume of whole blood. So, it is also known as packed cell volume or PCV. It is a screening test for anemia or polycythemia. A volume of anticoagulated blood is placed in a glass tube which is centrifuged, so the blood will be separated into three layers: red cells, buffy coat of WBCs and platelets, and plasma. Ideally, there should be complete separation of the three layers. Hematocrit is the ratio of the height of red cells column to that of the whole blood in the tube. Winthrop tube is a 110 millimeters long, narrow, thick-walled tube, an internal diameter of 2.5 millimeters. It is graduated from 0 to 10 centimeters, with graduation both in ascending and descending order on two sides of the tube. The scale with the markings from 0 to 10 from above downwards is used in ESR determination, and from below upward is used for hematocrit or PCV determination. Apparatus required to measure PCV by Winthrop method: Winthrop tube, centrifuge machine, Pasteur pipette. Procedure: under aseptic conditions, obtain a venous blood sample. Carefully mix the blood sample in EDTA vial by repeated inversion. Fill the Winthrop tube with the help of Pasteur pipette to the 10 centimeters mark. There should be no air bubbles. Place the Winthrop tube in the centrifuge machine and other Winthrop tube filled with water on the opposite side so as to balance it. Turn the centrifuge on to the slow speed and then gradually increase the speed. Centrifuge for 30 minutes at 3000 revolutions per minute. After 30 minutes, stop the centrifuge machine and allow it to stop by itself. Take out the Winthrop tube and note the readings directly off the graduation. The red cells are seen packed at the bottom, and straw-colored column of plasma is seen above that. In between, there is a grayish-white layer consisting of WBCs and platelets. This layer is called the buffy coat and is 0.5 to 1 millimeter in thickness. Read the level at which erythrocytes meet leukocytes. Quality control. The test should be performed in duplicate to check for imprecision. The duplicate test should not differ by more than 50%. Sources of error. Hemolyzed samples may give falsely decreased results and should not be used. Blood must be well mixed and should be at room temperature before testing. The time and speed of centrifugation are important factors in obtaining maximum packing of the red cells. Inadequate centrifugation will result in falsely elevated results due to excessive trapped plasma. The blood to anticoagulant ratio is particularly important, especially when using EDTA. Excessive EDTA will cause a falsely decreased hematocrit due to shrinkage of the red blood cells. Falsely increased hematocrits may be reported. The buffy coat, which is comprised of white cells and platelets, is usually a very thin whitish layer above the red cells that can be observed when the blood is centrifuged. In disease states where the white count is excessively elevated, inclusion of the buffy coat can cause a significant error. Failure to read the hematocrit within 10 minutes after the centrifuge stops will result in predispersion of the red cells in the plasma and a slanting of the red cell plasma interface, causing a falsely elevated reading. Even when the hematocrit is properly centrifuged, there remains a small amount of plasma trapped in the red cell column. When comparing manual hematocrits from an automated instrument which does not have trapped plasma, the manual result is usually about 1 to 2% higher. Normal ranges for PCV in adult males 40% to 50%, and in adult females 37% to 47%.
So this is up to the PCV or hematocrit estimation, and in next class we will start with the erythrocyte indices. Thank you very much.